Okay, so now we're going to continue on talking about endocrine disorders. And so with the endocrine system, we're going to start with an overview. And so as you may remember from your anatomy and physiology classes, the endocrine system, we've got this group of glands, and so they actually work together. It's like a closed system, and then these glands and these cells, they secrete hormones that act on other parts of our body. So basically, the amount of hormones circulating in the blood is what is going to trigger different factors that control production. So it's a feedback loop. So the body recognizes the amount of hormone in the blood and decides whether it needs to produce some more from these glands in order to achieve the desired effect. So we're talking about pathology and disease states. So diseases can come from when there's just too much or too little hormone that's been produced. Maybe that's caused by the gland dealing with some sort of dysfunction or some sort of problem in the mechanism that controls hormone production itself. And so with our endocrine disorders, you can very often look at the root word and figure out which organ, or which gland, I should say, is involved. So for example, 2 and 3, we're going to be talking about hyperthyroidism, hypothyroidism, and we can see the root there, the thyroid is what's involved. And so we're going to start off first with our first one, hyperpituitarism. And so in hyperpituitarism, let's start by looking at our image of the pituitary gland. And there we've got at the base of our brain, we've got our little pea-sized pituitary gland divided into 2 lobes. We've got our anterior pituitary and our posterior. Now that anterior pituitary gland is responsible for stimulating so many of the hormones that we are accustomed to talking about. It's the one that's responsible also for growth hormone. So many people are familiar with that. Now, with the anterior pituitary gland, when excess hormone is produced by it, that's when we're talking about hyperpituitarism. And usually that's caused by the presence of a benign tumor. And based on our nomenclature that we talked about for tumors in chapter 7, we're going to call that our pituitary adenoma. So we've got this excess hormone that we mentioned. The anterior pituitary is responsible for releasing that. And then there's 2 conditions that can come as a result. The first one is acromegaly. And so that one results when all that hypersecretion that's coming from the anterior pituitary gland, when that happens during adult life. So we're saying post-puberty, after the closure of the long bones, when those plates have been sealed. And that one is actually pretty rare. It's thought to be about 65 people in a million. And then there's gigantism. So that one happens when that hypersecretion, instead of happening after the closure of the growth plates, but that one happens before. So that we look at with younger people. And so because it happens with younger people, it is pretty rapid seeming. And so we have an excessive growth of the whole skeleton, the entire thing, sort of this overall large person. And they can grow to be, more than 7 feet tall very often. Here we have our image of Andre the Giant. You might be familiar with him. He was a French wrestler, eventually came and wrestled in the States, and he's probably best well known for his role as Fezzik in The Princess Bride, if you're old enough to have seen that. And he is someone who suffered with gigantism, or at least initially that was thought what he had, that was what he had. And then later the thought was that he had acromegaly. And when we say suffered with, acromegaly is thought to have slower effects. And some of these effects include things like poor vision, photosensitivity, the bones in the hands and the feet specifically on their own are larger. And then something that's known as barrel chest, and we can see sort of an increase in the rib size as well. Now we say suffer with because despite the fact that people are much larger, they also deal with increased muscle and organ development, but still they end up being particularly weak or suffer with weakness from time to time. Then there are other mucosal changes. So this is where it affects us. Many have thickened lips and may also deal with macroglossia. So we have this image here so we can see that enlarged tongue because remember, their body is enlarged. Then there are other facial changes that are evident. And so in this picture, we've got a 64-year-old woman with acromegaly, and we might look at her and say, well, does she really deal with those changes? But let's examine them. So the facial changes include enlargement of the maxilla and mandible and everything that you would expect to come with that. So imagine these bones are enlarging, and then with that, the teeth aren't going to change size with it. So you're going to end up with separating teeth, malocclusion, of course, because things won't fit together quite the same. Who's to say that as these bones are enlarging, they're going to enlarge at exactly the same rate? Mandibular prognathism, apertognathia, so the open bite. And then also with the facial bones, there's frontal bossing or enlargement of the forehead, and then also the enlargement of the nasal bones themselves, which we can see with our woman here on the right. And then changing the sinuses. As you know, sinuses can affect the way our voice sounds, so there'll be vocal changes such as a deepening voice. And so now we can compare her. If you didn't think she was exhibiting signs before, now you can see how she looked 11 years earlier. And so remember we said that acromegaly actually was sort of a slow process. So let's look at the change. Here she is in 1977 and now again in 1988. So what changes do you see over time? Can you see the nasal bones changing? Can you definitely see the difference in the frontal bossing? Her hair makes a difference in changing things, but in covering them, I should say, but you can see the difference. Also, look at the size of her lips and the maxillary bones as well. So that's a pretty difficult thing we could imagine for anyone to deal with. And so how do we deal with diagnosis and treatment? Well, first, diagnosis involves measuring the actual hormonal levels. So glucose is administered, and in a normal person, the administration of glucose will result in a decrease in growth hormone. But with someone dealing with acromegaly, that growth hormone is not going to decrease. So that would help them to know that this is in fact what we're dealing with. Then when it comes to treatment, there's, of course, surgery, right? So removing the pituitary gland tumor, the adenoma, would be one straightforward way to deal with that. And that actually has a pretty good prognosis. Another way is just to manage it medically, particularly if surgery is contraindicated. There's also radiation therapy that can usually result in some slower results. It's a little less successful. So that's trying to shrink the tumor through radiation. And then there's the option of leaving it untreated altogether. But we're talking about enlarged organ growth, uncontrolled hormonal release. So we've got diabetes, cardiovascular disease, respiratory diseases, colon cancer, and the like. Really, enlarged organs can result in a doubled risk of cancer, especially GI cancer, doubled risk of cardiac disease. So now let's move on in our discussion of endocrine disorders, and we'll go on to hyperthyroidism next.